So I'd like to welcome everybody back to our capstone presentations for 2024 at Elizabethtown College, and I'm pleased to introduce Dana Richmond. She is an alumni of Elizabethtown College, so she's extending her degree with us. She's been teaching as an adjunct at several universities for the past couple of years and is looking to expand those opportunities. And so she took her capstone to really look at how to enhance some of her teaching skills. And so I'll turn it over to you, Dana. I'm excited to hear what you have to say.
Thank you very much. Yes. So that's what I wanted to look at. My goal in getting my doctorate in occupational therapy is to move into academia full time. And so I wanted to look at our one of our courses, but course curriculum and design, and look at how we can help our students be better prepared to be great OTs. There we go. Okay. So why is this important, right? So as an adjunct professor, we're looking at our students and how they're going to go through their course curriculum and how they're going to do when they go for their fieldwork exam, go for their fieldwork opportunities, as well as sit for their NBCOT exam, and then enter the world as clinicians. And so that's our goal as universities is to help our students through that process. And so what ACO and AOTA ask professors, every semester at the end of their semester to look at their courses and look at their course evaluations and make changes as necessary in this ever growing and field of occupational therapy to make sure that we're up to date with most evidence-based practice and how we're helping our students. One of the things that is my passion is fieldwork readiness, fieldwork preparation, as well as being a fieldwork supervisor. And so what I wanted to look at is how we're preparing our students for fieldwork. For those who are OTs on the call, you know that our students need to have two 12-week fieldwork opportunities. For those of you who are not occupational therapists, why do we do that? Why is that necessary? And it's to make sure that our students have these strong clinical reasoning skills and that they're able to navigate, diverse patients and come up with these treatment plans. And as we know, in a post-COVID world, our patients have more comorbidities, things are more complicated, diagnoses are more challenging, and how are we making sure that we're changing our curriculum and preparing our students for that as they go into their level two fieldwork experience. What I did was I went to the literature and I wanted to look at, what makes students successful in fieldwork. So first we have to understand, what is fieldwork and how are they successful? And what we found was that students who are successful in fieldwork typically are successful for their professional behaviors, as well as their clinical reasoning skills. So I looked at clinical reasoning skills. Professional behaviors is very important, but from a research standpoint, in curriculum design, that clinical reasoning piece is very important in curriculum. So I went with the clinical reasoning piece. And so what is fieldwork looking at, right? So fieldwork is at the end of their didactic education. Typically in education, we're looking at case studies, they're having problem-based learning, they're having experiential learning. And then after they go through these courses, then they are able to go to their fieldwork opportunities. Fieldwork gives the students an opportunity to practice their skills and showcase their professional reasoning. And the reason, clinical reasoning is so important in fieldwork is because it's what's helping our students and therapists, evaluate clients, design those interventions, and adapt care, which is what OTs are doing, right? So what is clinical reasoning? So clinical reasoning is defined as a cognitive process for decision-making and client care. There are 5 different types of reasoning: procedural, interactive, conditional, narrative, and pragmatic. And research shows that all 5 of these are needed in order to be a successful clinical reasoner. But typically, these novice practitioners are often rely on this procedural reasoning only, which is focusing on the impairments of the client, where when we look at conditional and narrative and pragmatic reasoning, we're looking at decision making, we're looking at the context in which the therapy is taking place, and we're looking at communicating with the client. And so all five of these are really important for clinical reasoning skills, and our students need to be looking at all five of those, meeting all five of those goals. So how do we teach clinical reasoning? So as professors on the call know that each course and each professor has their own way of their own teaching style. And so the course that I help adjunct for, that professor, her learning style is she uses the Kolb's learning cycle. And so we continue to look at that since this was not a new course, it was a course that had been taught previously. But what the literature shows is that when we teach clinical reasoning skills, experiential, hands-on learning is one of the main ways to teach clinical reasoning skills. Other ways are problem-based learning and service learning and lab experiences. So we know that we have standardized patients that come in. They do have lab experiences and these practicals, but they're also working on this problem-based learning. Sorry. And so what happens is once these students are, going through these clinical experiences, I actually had an OSCE earlier today for my students. We see how it all comes together. We see how they're taking this kinesiology course, the anatomy course, and how when they go to work with the standardized patient, how their motivation changes. They're super excited to work with the patient, and this is and helping them with their clinical reasoning skills. So service learning is under the umbrella of experiential learning, and Kolb does state that experiential learning is one of the best ways to teach clinical reasoning skills. The university that I work with does a lot with service learning. They do a lot in the community. They have a pro bono clinic on campus. Their students are in non-traditional level 1 sites where they're actually out in the community, in senior centers, in schools, and daycares. And so service learning is a big part of this university where I'm at and their culture. So it's something that they were kind of already doing. And so I kind of looked at how can we incorporate that into other classes because service learning is so important for clinical reasoning skills. And so basically the benefits of service learning is improves critical thinking, cultural competence, and personal growth. It's more than volunteering. It's not that the students are going out and volunteering in these communities. They're actually bringing these OT skills into the community. So even though they are students, they do have an OT who is supervising them from the school. And so it's great for the community because it's typically meeting a need. There isn't an OT at these sites. And so typically the sites that they are at can benefit from one. So it's a great relationship between the school and the community centers that they're at. And so it's great for the students because they're excited to be out. OT really we attract a culture of wanting to do. We're not people who want to sit kind of behind a desk. We want to be out there. We want to be hands-on. And so it's really great for the students to kind of get that experience as well as, work with the community who's so grateful to have them. And so after we looked at what do we need for field work, our students need clinical reasoning skills. How do we teach clinical reasoning skills? Okay, we have these service learning opportunities. Let's look at the curriculum and see, are there any classes that maybe are not incorporating or could be incorporating more these clinical reasoning service learning opportunities? And so when we were looking at the curriculum, we found that our colleges have an assistive technology class. And so it does go along with an ACOT standard. I will get to that. But we're looking at the AT course in relationship to OTs, and there's a great presentation yesterday. OTs are a little nervous about assistive tech. We know that there's modifications that have to be done. We're really good at like home modifications and durable medical equipment, but when we're looking at, how do we take these assistive technology and universal design principles, how do we take an object that already exists and make these adaptations? And so the literature kind of shows that OTs kind of struggle in this area. And so the fact that this university has this course is great for our students. But when we looked back at that Kolb's learning style, those 4 aspects of Kolb's, which I'll talk a little bit about in my discussion session, we weren't necessarily meeting all 4 of the learning cycle. And so how could we expand upon that? So this is the A code standard for assistive technology. It's a pretty large standard. And if you read this and you think, how are we going to meet this in this class? The first thing that comes to my mind is all the clinical reasoning skills that the student needs to meet this standard, right? So the standard's looking at assessment of AT, it's looking at design and fabrication, it's looking at applying the assistive tech to a patient, it's looking at how the students are going to figure out how to fund it. And so all of this is really revolves around clinical reasoning skills, right? Making sure that the client's able to figure out, how looking at the client preferences, looking at contextual factors, looking at ethical issues. And so clinical reasoning definitely plays a role. So after we looked at the literature, the research question was, if we add an experimental learning opportunity to the AT course, in order to improve our students' clinical reasoning skills, will the students' fieldwork readiness improve? And the method in which we did that was we used a mixed method design. I used a pre and post survey. The survey had a 9 Likert scale questions for the pre-test, and they looked at fieldwork readiness, ability to use assistive technology and client interventions, and clinical reasoning skills. The clinical reasoning questions came directly from the AOTA fieldwork assessment form, and then the assistive tech and fieldwork readiness questions I created. We were able to get IRB exemption from Elizabethtown College. My participants were 25 first year, second year OT students at a public university that were enrolled in a 16-week assistive technology course at a large public university. Consent was given by a consent form as well as filling out the survey. And there were some prerequisite courses that needed to have been taken before they were able to enroll in the assistive technology class. The other thing then we looked at was how are we going to modify the assignment? So like I said, this class had run previously. There was a toy challenge, the assignment was called. And what happened last year was the students were provided with an impairment. It was low vision, sensory impairment in the classroom. And then they were asked to modify a toy. But there was no service learning component to it. So typically like in a fieldwork class or in an adult intervention class, we're bringing in the standardized patients, we're letting the students kind of go out into the community and all of that kind of works together in the course. But specifically for AT, it's typically a little bit harder for that to happen. And so it was all hypothetical. They weren't actually like looking at a patient. And so what we decided to do was, since they were going out on their level 1 fieldwork at the same time of taking this assistive technology class, the students in the level 1s were going to schools or daycares. And so we said, well, wait a minute, why don't we let the students go out into the daycares or the school and choose the patient that they want to work with, pick a toy that they think, pick a toy for the client and use these assistive technology principles to make the toy appropriate for this client. So again, that service learning component of the community daycare or school. And this reflection piece was really important to making sure that we were reaching those higher levels of clinical reasoning skills. Again, this survey, the pre-survey had 9 Likert scale questions, and the post-survey had the same 9 Likert scale questions. So they had to say like strongly agree, agree, neutral, strongly disagree, or strongly disagree. And there's also 2 open-ended questions so the students could comment specifically on how the assignment impacted their fieldwork preparedness, as well as anything else that they wanted to add. And we used Qualitracks to make sure that the surveys were anonymous. So what did we find? So basically, what we found was that 8 of the 9 Likert items, specifically in regards to enhanced clinical reasoning skills and AT skills, showed an increase. So when we asked the students, how do you feel about using assistive technology in the clinic, or those AOTA fieldwork questions from their evaluation, all the scores went up, right? They were like, yes, strongly agree. We think our clinical reasoning skills are better. We're going to be able to adapt and grade interventions easier. We're able to, use our AT skills in the clinic. 8 of the 9 questions, we saw an increase in how the students were feeling that they performed. The one question that we did not see a change was when we asked the students how if they perceive themselves as being ready for field work. So the question read, um, I feel prepared to complete my level 2 fieldwork in the spring of 2025. The pre-test showed that 33.3% of the students strongly agreed. However, the post-test showed that only 13.6 of them agreed and 40.9% of them moved into that neutral category. Um, so that was our quantitative. Our qualitative results were interesting. So we had 20, I forgot to say before. So we had 25 students that were enrolled in the class. We had 22 surveys come back, 22 surveys come back out of the 26 students enrolled in the class. 20 of the 22 students said in the qualitative results, so that question of did you feel the toy challenge specifically improved your preparedness for level 2 fieldwork? 20 of the 22 students said yes. So it was and these were some comments that we had from the students. So they specifically said the toy challenge helped me be more creative with objects, strengthen my clinical reasoning and observation skills. The students felt that the toy challenge taught them how to analyze where the client is struggling and adapt accordingly, and helped enhance their problem solving skills. And they felt that there was great carryover from this experience, will be great carryover from this experience to their level 2 experience. So what does all of this mean? So what we found as far as this hands-on experience, this service learning, what we found was that the toy challenge increased the students' ability to clinical reason, as well as their ability to use assistive technology in their practice, which is what the literature is showing. And what was really great was that the reflection piece really is what helped this, I feel. And what the literature shows is that having this reflection piece of, okay, so the student had to take a toy, had to use it with a client, right? Then they had to write a reflection and say, did this go according to plan? Did the client want to play with the toy? Did it achieve the goal that you thought it was going to achieve? After they reflected on it, and we thought was going to happen did happen, was that the students were like, oh no, wait a minute, like this did not go at all like I planned. So they had to make further assistive technology changes to the toy, and then they had to go back to the same client and try it again and say, okay, did it work this time? What were the differences? And so this really promoted this clinical reasoning, higher level thinking. What was interesting is that one of the quotations from the question, anything else you'd like to add, a student said, I wish there were opportunities to practice this skill with other populations. And when I read that, what was interesting is that technically they should always be doing that, right? When they go out on their level ones for their adult community, we're asking them to write treatment plans, or asking them to write SOAP notes. And so as therapists, this is what we should be doing anyway, but the students are not necessarily making that connection without this reflective piece that we had them do for this particular assignment. I would also say that I definitely thought that the students' perception of fieldwork readiness would have improved, and it did not. And so I kind of went back to the literature to see, why do I think that happened? And one of the things that one of the limitations of the study is that this is truly just their perception, right? There was no actual, we don't actually know how they're going to do, right, on the level 2 fieldwork yet. So this is their perception of how they're going to do. And as they're getting closer to fieldwork, because they do go out, we're at the end of the fall semester, they are going out into the spring semester, they will go out into this level 2 experience. As we've gotten closer, I think they're getting more nervous that it's coming up. And I think that, again, one of the limitations as well would be that I didn't account for that. And the other thing too is that competency is highly related to self-confidence, the literature says. and there was a grade associated with the written reflection, and the grades were not released until the survey was completed. And so that might have skewed the survey results slightly, that the students are very grade oriented, and that because they didn't know how they did on the assignment, it might have skewed their perception of how they're going to do in fieldwork or how they did in this experience. So future research and conclusion. So again, the toy challenge assignment helped improve perception of clinical reasoning and AT intervention skills. Again, we don't know if it actually will improve their fieldwork scores. So future research would definitely be for me to look at how the students do as they go out into fieldwork this coming spring and compare their fieldwork scores from their AOTA assessment form to last year's group. So again, both groups had a toy challenge, but without this service learning clinical reasoning piece, and to compare, how our students do, how they're doing, how they do this year versus how they did last year would be future research for the institution. So I'd like to thank Dr. Carrie Himble for being my advisor, my husband Brian for supporting me through the 2 years of my OTD, my parents who have helped me, as well as my 7.5-month-old daughter, and Natalia, who is my wonderful, great friend and mentor, who really helped me as well with this project. So thank you to everybody. And I would open it to questions.
So as we've done with all of them, you're welcome to ask a question by unmuting yourself, or you're welcome to type it out in the chat bar, and I'll moderate that chat bar. But I'll start by saying, congratulations, Dana. You did it. You
Thank you.
you made it, right?
Yay!
One who has a really little one who doesn't love to sleep. It's been definitely a challenge. She's also working full time while adjunct teaching. And so I just want to acknowledge that she's had a lot of
And
balls in
finishing my last class for this
and
degree.
finishing her last time. Right. So she's doing more things than one all at the same time. And I just wanted to acknowledge that. But I'll open it up to questions, and then I might have one if it doesn't get asked. We'll go. I think Tam has one.
Of course I have one. Yes,
I
absolutely.
know.
Hello, Dana, and it's
Hi,
good to
good
see
to
you.
see you again.
And you probably know, critical thinking, clinical reasoning is my passion. So I'm really interested in your project. And again, I think you answered all the questions as you were going through. This really is about the students' perceptions. It's really, yeah, they didn't have their grades, so they didn't, they had to figure out whether they thought they were doing okay or not. So I guess it's a very pragmatic question, but did the students do well in their grades? And then also remind me again, you may have said this and I missed it, but I know there's a reflection piece to this and the fieldwork component piece of it. But what were they asked to do the cohort and did this project? What were they actually asked to do?
The cohort previously, yeah. So
Yeah,
they had to still do a toy challenge, so they still had to use assistive technology principles to modify a toy, but the instructor gave the students the impairment. So they were provided with it wasn't even a hypothetical case. It was just like, you're going to work on, you're going to get this book, and your
yeah,
patient's going to have a sensory deficit. So how
okay,
can you use assistive technology? But we provided that to them,
yeah,
where the main difference for the clinical reasoning piece this time around, and I apologize if it wasn't clear, was that they had to go out to where
yeah,
they were at the level 1 site and choose the client themselves and
yeah.
come up with the impairment list themselves, and come up with that all on their own.
And it sounds like they were again, figuring out what worked, what didn't work. And I think to me, that's always the clue, right? So it's when students realize that what they first come up with doesn't work, and oftentimes it doesn't, then if they're okay with that, then they can go ahead and think about what the future is. So yeah, so it sounded like that extra step of like, this didn't work and what would I do next?
Yeah.
Certainly was quite helpful, and maybe also a very different level of critical thinking. But
And like I
I,
said, it's interesting
so
the
yeah,
comment that we received that they're like, oh, because this is following they did a level one experience that was similar to this, but with older adults over the summer. And it's the same setup where they have to do intervention planning and run groups and write SOAP notes. And I help supervise them through that process. But what's interesting is like, they're supposed to be doing that all the time, but we weren't specifically asking them to write a reflection on it. And so when they came back and said, oh, I wish we had done this for other classes, I'm like, well, you should be, but it was interesting that the reflection piece is really like what helped them make that connection,
yeah,
because we were asking them specific questions like how did it work? And I think also because it was within assistive technology course, I think that kind of not ensured that it wasn't going to go well the first time, but because these were the first time that they were working with these principals, all of the students needed to go back and redo it, reassess, which was
yeah,
great. And that's how we kind of ensured that that clinical reasoning piece was going to be a part of the study, was because this was something that they hadn't experienced before.
yeah. And my experience is that students, who, when they realize that they didn't do it right the first time, is that self-doubt, and then they go like, okay, I guess I'm really not ready,
Yeah,
right? Yeah, so I think that, but I haven't met a student yet who was ready to go out in field work and ready to and say, I'm ready,
I'm ready.
I'm ready. So,
Yeah.
but thank you.
Thank
Yeah,
you.
I think initially, and this was kind of my question, but I think it's turning into a comment, was more like when you first got your initial results, you were really disappointed because you
Yeah.
saw the perception go down. And I was actually like, no, no, that's expected because when they make mistakes, they think that it's bad and it's not.
Yeah.
It's the ability to like turn that around. So I would say that probably was your biggest surprise that it went
It
down.
was my biggest surprise. And also when I got the pre-results in, I remember saying like, wow, they're really confident. Like, I know, how is it going to get better than this, right? Because I really thought their perception of fieldwork readiness would improve, right? That's something, we kind of worked through together. But I remember when I got the pre-results, I remember thinking like, what am I going to do? Like, how is it going to get any better than this? Like, they're really confident that they got this, and I'm thinking to myself, I don't know if they got it, right? But, you know, so
Yes,
yeah.
welcome to teaching high-level clinical reasoning classes. Absolutely. So, Dina, one last question and then we'll move on. What's your plan to do with this work moving forward?
Yeah, I'm really excited actually to see. We actually had their fieldwork prep day for the students yesterday, and they're super excited to go out. I'm excited to see and support them in this journey as they go out in their level two fieldworks, and then again, kind of look at how they do on the fieldwork education, the AOTA's fieldwork
Mm.
form, and then compare it to last year's group and to see, if there was a change, and what kind of changes it look like. So, yeah,
Excellent. Nice job, Dina.
thank you.
All right, so with that, we're going to stop your